People have a lot of questions about egg donation. Before I answer some of them, let me just say thank you for considering being a donor. Many couples suffer from infertility and would be grateful for your generosity. It's a huge gift. I've been an egg donor, so I know all about the process. Out of the many questions that people ask me, the two most common are, does it hurt? And can you have kids of your own after donating? First, let me say that there are shots involved. So if you're overly sensitive to needle pricks, then you might consider it scary, but I was fine once I got the hang of it. And egg donation does not affect your future ability to have children or increase your risk of cancer. You start the donation process with an application that asks questions about your health and your family history. As you can imagine, there are strict guidelines for egg donation, so be prepared to answer a lot of questions. There are two parts of the application. One is more of a screening, and the next is more specific questions about you, the donor. If you are selected for donation, then you will meet with a nurse who walks you through the entire process in detail. From start to finish, it consists of a physical, blood testing, ultrasound, and meeting with a psychologist. Now, keep in mind that you do not pay for any of this. You get to learn a lot about your health, and GRS takes care of it 100%. After the initial tests are complete, you will begin taking oral medications and learn how to give yourself injections. Now, don't worry, the needles are very small and about the size of an acupuncture needle. The shots last for about 12 days, give or take. An ultrasound and blood test will ultimately determine when you are ready for egg retrieval. You also need to know that none of this medication is harmful for your health or has lasting side effects. The retrieval itself is easy. The anesthesia puts you to sleep for about 20 minutes, so it's quick and you won't feel a thing. A few days after the retrieval, you will go back for a checkup and receive your compensation of $6,000. Once you're approved, the treatment cycle takes about 3 weeks. It sounds really easy, but it's a time commitment and a huge responsibility. But the staff at GRS made me feel comfortable and were very supportive. And were always available to answer my questions. It's pretty cool. And just remember that your gift is giving a couple hope of starting a family. So if you're ready to get started, then go to ivf.com and click on the link for egg donation.